Thank you, everybody, for joining this session. It's always great for me to touch base with folks and report on what we've been doing in DC and to see how you're doing as well. We've been through a very rough period in New Jersey and in our country these last few weeks, obviously, and suffered a tremendous cost. In New Jersey, we've lost over 10,000 people to coronavirus, and that number is just the official number. The true death toll is almost certainly significantly higher than that, and I'm sure everybody on this call at this point knows somebody who has been affected. But we are making progress in New Jersey, perhaps even more impressive progress than any other state, because we were hit harder by this than any other state. We are making progress in bending that curve. The crisis was at its peak in mid-April. There was a day or two in mid-April when we only had about 100 critical care hospital beds left in the state of New Jersey for the whole state. That's how close we were to our healthcare system being broken by this. Ever since then, the numbers have been coming down just about every single day. We're down to just over 800 people on ventilators. That's down from 1,600 in mid-April, so we've cut that number in half. About 1,000 people, in critical intensive care. We also cut that number in half. About 3,500 hospitalizations, down from 8,000 in mid-April. So that is significant, measurable progress, and it's come about in part because people made good decisions at leadership levels, in large part because of our frontline heroes, our nurses, our doctors, the folks taking care of patients in our hospitals and other healthcare facilities. But perhaps most important, those numbers have come down because of all of us, because virtually every single person living in New Jersey followed the public health advice and decided, despite great personal sacrifice in many cases, to stay at home, to follow the guidelines, to do all the things we have to do to keep our loved ones and our neighbors and our communities healthy and safe. I know this has been a difficult period for a lot of people who, including people who were never sick, because jobs have been lost, because small businesses have shut their doors. But the sacrifices we have chosen to make, have made a significant difference. They have saved many, many lives. They have enabled us to get to a point where we can think about recovery and rebuilding our economy. So everybody should feel, I think, somewhat proud of that. We've been working hard in Congress. I have been working incredibly hard to try to ease the economic burden that all of us are facing. We've passed several pieces of legislation that the president has signed to provide relief for small businesses, for people who are unemployed, and for every American making less than $75,000 a year, who is, all of us are entitled in that category to receive stimulus checks. Those programs weren't perfect. There were many, many problems, particularly with the small business program at the very beginning, when our banks, many of the banks, were telling the mom and pop shops that were not their normal customers to go to the back of the line. We've worked very hard to fix those problems, and we've made a lot of progress there too. We've seen a significant increase in the number of small business loans given to New Jersey small businesses in the second round of funding for that program than in the first round. And many more of those loans are going to the true system. And last week, we passed in the House, at least, the largest, most ambitious piece of legislation yet to respond to the coronavirus crisis. My number one priority in that bill was to try to get relief for our state and local governments. Here in the district that I represent, we have 75 small towns. All of them have to balance their budgets. All of them have to pay their cops and their firefighters and school teachers. All of them are trying to keep parks open. All of them want to keep those community pools and summer programs for kids running. All of them want to continue to provide the services that we rely on our small towns and our county governments to provide to us. They cannot do it without help because revenues are drying up because the economy is shut down naturally. So in this bill that the House passed, we got what I was fighting for. We got a very large, very generous, and very flexible program of relief, not just for big state governments, not just for big counties, not just for big cities, but for every single small town in America and in our congressional district. If the Senate passes this bill and the president signs it, and we still have a very long road to go there, it would mean almost $40 million immediately for Warren County, about $4 million for the town of Phillipsburg, $2 million for Lopatcong, around $1 million or so for most of the other towns that I represent in Warren County. That's incredibly important, incredibly urgently needed, and we all now need to focus on the Senate, make sure that they take this bill up. There's a bunch of things in this he doesn't like. That's fine. Politics down. You talk what you want, you say what you don't want, you negotiate, you find common ground. That's where we need to be on this bill. And one of my priorities is make sure that state and local funding remains part of that common ground. It certainly is in New Jersey. In my district, 54 of our mayors and county freeholders, Republicans and Democrats in equal measure, wrote to the congressional leadership a few weeks ago asking for this relief. And state and local officials of both parties from across the country have been doing exactly the same thing. And so this message is bipartisan, it's consistent, and I think it will be strong enough that in the end we are going to get something significant for our communities. We did a lot of other important things in this bill that we just passed. Hazard pay for our frontline workers who have been who have been on the job every single day, while many of the rest of us have been working from home, risking their lives to maintain basic services. We believe that those Americans should be rewarded and recognized. We had funding in there to ensure that the post office can survive this crisis, and we need that more than ever today in a moment when we are more dependent on deliveries than ever before. We had more funding in there for states to make sure that it's safe for everybody to vote in the November election. That should be a no-brainer, a nonpartisan no-brainer, and we're going to have to fight to make sure that it survives in the final bill. And on top of that, more funding for the public health response we all need to get out of this: testing, contact tracing, isolation of those of us who may still be sick. This is where we have to go next. It's been a struggle in the state of New Jersey to get enough testing for everybody beyond those who are symptomatic, beyond those who are clearly and obviously sick. That's obviously where you have to start. You got to make sure we're testing the most vulnerable people, folks in our senior homes, folks in our prisons. But if we want to reopen the economy safely, and all of us want to do that as quickly as possible, we need to have enough coronavirus testing so that anybody who wants to go back to work or go back to school can get a test to make sure that they're okay. and then get a test again, and then get a test again. Because until we have a cure, until we have an effective treatment, and then eventually a vaccine, that is the only way that we can return to normal life and still be relatively protected. So I've been on the phone with the governor and his team. I've been working in Washington to try to make sure we get them the resources they need to put that kind of program into place. Because unfortunately, it is going to be on us. It is going to be on them. We're not going to get leadership from the White House on this. President Trump is absolutely committed to making sure that everybody who works for him gets tested every single day. But as for the rest of us, I think we're pretty much on our own with the money that Congress has been fighting to provide. So that's basically where we are. There's a lot of other issues we can talk about. I know a lot of folks are still experiencing individual problems benefiting from the programs that we created. And my team has been working around the clock, helping our constituents deal with those problems. We've been able to help folks get through employment competitions, state and business, because Congress made a promise to them, and Congress is going to keep that promise. If it's the last thing I do, I will make sure that we keep the promises that we've made in this legislation. So with that, back to you, DeAndre, to lead our discussion.
Thank you, Tom. And again, for everyone on the call, if you have a question that you would like to ask the Congressman live, please just use the chat feature at the bottom of your screen. Please include your name, the town you're from, and contact information. Tom, your first question. Why were big banks allowed to take such big fees on PPP loans?
So banks of all sizes were allowed to take a fee on the PPP loans. This is the small business forgivable loan that we created to encourage businesses to keep their employees on payroll through this crisis. And we designed this program in a way that that basically gave banks this obligation to administer it. We thought that the Small Business Administration was frankly too small to handle a program that was supposed to get hundreds of billions of dollars out the door in a few days to millions of small businesses around the country, that we needed to enlist our banks to do this job for us, for better or worse. And since they were going to do the work, it was, in my view, appropriate to allow them to charge a small administrative fee to cover the work that they and their employees were going to have to do. I think the fee initially was structured in a way, in combination with some other flaws in the program, that encouraged, or at least didn't discourage, the big banks from serving their larger existing customers first. Looking back on it, they clearly had an incentive to do that. Their biggest incentive, I think, was not the fee, but the fact that these were their existing customers, and from the bank's point of view, they wanted to save their existing customers first because they wanted to maintain those relationships. Those customers may have owed them money from previous loans, and so left to their own devices, that's what they did. We tried to fix some of those problems in the second round of the PPP. Most significantly, we set aside a lot of the money in the program for smaller community-based banks and credit unions, which we felt, and well, we know, are just a lot better working with truly small businesses than a Chase, Manhattan, or Bank of America. And indeed, in the second round of funding, as I mentioned, we've gone from about 33,000 small businesses in New Jersey getting their money in the first round to over 70,000 in the second round. I'm sorry, over 90,000 in the second round. And that's as of about a week ago. We don't even have the updated numbers, so it should be significantly more than that now. The average loan size has gone down from over $200,000 to around $70,000 in the second round. So you can see that the loans are going more to the truly smaller mom and pop shops that are taking out less money. So, it's not perfect. We still have, I still have constituents who should be getting their money and haven't gotten it yet, and we're trying to help them, but things are going a lot better than they were at the beginning.
Thank you, Tom. Our next question that we did have frequently asked in the previous submitted questions, Sherry from Phillipsburg asked a similar question today. So I'm going to let her read this one, Tom.
Sure.
Sherry, can you hear us?
I can. Can you hear me?
Yep.
Okay, great. Hi, Tom. How are you?
Hey, Sherry.
Hey, I just want to say thank you for everything that you do for all your constituents in CD7. We're very proud of everything that you've done and look forward to you continuing that. I apologize, but I missed the number that you said for aid to Phillipsburg in that package. Was it 4 million?
First of all, when I said, hey, Sherry, my iPhone interpreted that as, hey, Siri, and started talking to me. I wonder if that happens to you often. So the number for Phillipsburg would be in 2020, it would be $4.7 million. And there would be a second round of this in 2021. Phillipsburg would get $2.3 million. This is based on population, basically.
Right. Okay. That's wonderful.
So, and then there are smaller numbers for Powhatan, Lopatcong, Harmony, Greenwich, Franklin, and Alpha, which are the Warren County towns in my district.
Right.
So every town, no matter how small, would get some assistance, and this money can be used to pay for expenses related to fighting the coronavirus, and very importantly, to make up for revenues lost because of the coronavirus. That's the big problem, that with businesses shut down, tax revenues are obviously also down, yet you still have to balance your budget, so something's got to go. And with revenue losses this great, it's going to be essential services. It's going to be people laid off, potentially first responders, teachers, and all of us in the community are going to feel it if we don't have some relief.
Right, right. I appreciate that because that was my next question. So you answered that, how we could spend it. My last question on that is, I know right now the Senate is saying dead on arrival for this package, but have you had any conversations with anyone in the Senate and maybe any possible modifications that might have to be made in order for them to get them to pass it?
Well, there have been a lot of conversations with the Senate, both before the passage of the HEROES Act and ever since. When Senator McConnell says dead on arrival, that's, this is a negotiation, and that's an opening position. Senator McConnell has also said that there are some things that he wants. For example, he wants to protect large businesses from lawsuits relating to the coronavirus. I'm not sure why that's his priority. I haven't heard from a single constituent in the middle of this crisis with 90,000 plus Americans dead who's told me that's their number one priority, but that's fine. If that's what he wants, and what we want is, help for people who are needy, and relief for our small towns and for our state and local governments, well then, that's the basis for a negotiation. And Speaker Pelosi has said, rightly so, I'm very glad she said this, that we don't have any red lines in the House. We're willing to talk about everything. And I think there is a basis here for a deal. For me, the most important things are the state and local funding, the significantly enhanced money for testing and contact tracing, because again, I think that's how we get out of this. And I think, from there, we can talk about everything else in the bill. mean, we do have to get something for the post office, and I think there'll be a deal on that, because I can't imagine there's any senator, Republican or Democrat, who wants to see the post office go bankrupt this year. So again, that'll be a negotiation, and we'll see where we end up. You know, be aware that there's a difference between the posturing of some of our leaders in public and the real hard work of negotiating a bill that goes on behind the scenes. I think there's going to be a lot of pressure on the Senate to act. As I mentioned, that pressure from the grassroots is bipartisan. It's Republicans and Democrats saying, look, we do need some help to get through this before the economy picks up again and lifts us all back to where we need to be.
Great, great. Okay, Tom, thank you so much. I really appreciate it. And good luck to you. Keep up the good work.
Thank you so much.
Thank you both. Your next question, Tom, comes from Maggie. I'll read Maggie's question for her. Given the high real estate taxes in New Jersey and the current economic situation, which is with its long and uncertain recovery path, how do we stop the outgoing exodus of people moving out of New Jersey to more affordable states? What's the outlook on reversing the SALT tax mess up that was helping us originally?
Yeah, so look, that's a really big and important question. And some of the answers have to come from Trenton and from our local and county governments. But the big piece for Congress and for the federal government is the SALT deduction, as you mentioned. Whether we agree with it or not, in New Jersey, we have chosen to pay higher taxes. A majority of us have chosen to pay higher taxes than the average state in order to have the best schools in the United States, in order to have better services and a quality of life that is also attractive to a lot of people who want to live here. Until 2017, and going back to basically the beginning of the income tax in American history in the 19th century, state and local taxes have always been fully deductible from people's federal income taxes. And that changed when the Congress in 2017 capped that deduction at $10,000. It was outrageous. It was, I think, a deliberate effort to hurt states like New Jersey that have made the choices that we have made. I ran on a promise to do everything in my power to reverse that. In December of last year, I helped lead an effort in the House of Representatives to pass a bill to get rid of the $10,000 cap. We did that in the House, sent it over to the Senate, which has not taken it up. And then in the HEROES Act, which we just passed last week, we did it again. We included a provision that eliminates the $10,000 cap, at least for the next 2 years. Now, Senator McConnell's response to that was, we're not going to do that because it's a tax break for millionaires. I'd like Senator McConnell to come to Phillipsburg and tell the average homeowner there or anywhere else in Warren County who has depended on this as one tiny piece of relief for the high local taxes we pay, that this is a tax break for millionaires. It's really, really offensive. And by the way, the first time I've ever heard Mitch McConnell be against a tax break for millionaires, because the real ones he's all for. In fact, the Senate slipped a capital gains tax break into the first CARES Act under his leadership. So, this is not getting a great reception, unfortunately, among Senate Republicans, and never has. So I can't make you any promises except that I will keep on fighting for this, and that the House of Representatives, the House majority that each of you helped to elect in 2018, is going to continue to fight for this. We will keep passing with every opportunity we have, legislation to restore the full deductibility of state and local income taxes. And eventually we're going to have, if not today, then in 2021, we are going to have a Senate that is going to agree with us.
Thank you, Tom. Our next question comes from Ed. Ed, can you hear us?
Yes, I can.
Hi, Ed.
Go ahead with your question, Ed.
Thank you. Hi, Congressman. How are you?
I'm good.
Great. First off, I just wanted to thank you for your leadership. It is sincerely appreciated. And I also want to thank you for the clear way that you describe things. You know, you make the complex understandable, and it's not easy, and I appreciate it.
Thank you so much.
Perhaps you were a teacher at some point in your career. I don't know.
Not officially, no. But we're all teachers at some point or other.
That's true. My question is about testing, and I asked you something kind of similar the last time you had one of these. You mentioned that the pathway back to work is testing. It makes sense. I mean, we have to confirm that we're not positive. We have to frequently retest ourselves to make sure that that's still the case. If we are sick, we have to quarantine. We have to do the contact tracing. All of that makes perfect sense. The questions I have, just a two-parter, is do you envision that this testing will be done in the home, or will it be done at the doctor's office? Will it be done at the drugstore? You know, how do you kind of see that testing, which is frequent testing, you know, it's fairly frequent type testing. How do you see that playing out? And then do you see that as that kind of pathway as a way for schools to reopen? Do you see children having to test so frequently, or do you see schools following some different model to try and reopen?
So the answer to your first question is all of the above. We now have we have new testing methodology, including a saliva test that was developed by Rutgers University right here in New Jersey, that the FDA has approved for home use using telemedicine. So you can use it at home if you have somebody, you know, on a video screen like this, just walking you through it. But it's such a simple test that you don't need to have someone in a hazmat suit, you know, using all kinds of protective equipment and a swab, collect the sample. So that's an advance, and I expect there'll be other advances that will make it easier and easier, including allowing people to test at home. We are going to have, I'm assured by the governor's office, and we've been writing them on this, in the next month we will have a number of drugstores across New Jersey begin to offer coronavirus testing, presumably using similar methodology, something that's very easy to administer and to use. So, you know, and then obviously through doctors' offices, through community health clinics, and the like, on top of the drive-through sites that many of our counties have set up. As for schools, I want to be much more cautious there, because that's a call that our public health authorities need to make. That is not a call for the congressman to make. My job is to try to make sure we have the resources to be able to make whatever decision is in the best public health interest of our students, our teachers, and all the staff who work in our schools. I want to make sure that they have this option if they decide, in consultation with public health experts, that testing would be helpful. We all want schools to be open live. You know, in September, our kids are already missing too much, both in-class instruction and then the joys of graduation and prom and all of the things that just, you know, are not the same when conducted online. So whatever it takes, my job is to fight for it.
Thank you.
By the way, you know, speaking of our schools, and a conversation I've often had with friends in Warren County, we also have grants available now from the first CARES Act for municipal governments and school districts that need help with broadband, with Wi-Fi hotspots. so that kids who have to be home and depend on good internet connection to be able to keep up with their classes have it. And so we very much want to encourage every community in my district that feels this need to contact us and apply for any funding that might be helpful to them, and most important, helpful to our kids.
Thank you so much.
Thank you, Tom. Just a reminder for everyone on the call, if you have a question at any point and would like to ask the question live, please use the chat feature at the bottom of your screen. Please include your name, the town you're from, and some contact information. That'll allow our staff to follow up after, if there's additional follow-up after the congressman answers the question. Our next question comes from Mary Jo. Mary Jo from Phillipsburg, can you hear?
Yes, I can. Thank you. And thank you, Congressman, for providing us this venue. I live in Washington Borough, but I work in Phillipsburg. I work for a nonprofit, Norwest Cap, and we provide services to individuals and families for unemployment, housing, education, financial empowerment, volunteerism. And I am the community development manager. We have a contract with the town of Phillipsburg for a neighborhood preservation program. We also have NRTC money. We have an opportunity zone, UEZ. My question is, and thank you so much for fighting for that $40 million for Warren, and specifically, again, I live in Washington Borough, but I work in Phillipsburg for the community development of, and that $4 million is certainly going to come, much needed help that we need in Phillipsburg. Is the funding that is coming, the $4 million, can that be used for rental assistance, mortgage payment assistance, and to help small businesses?
So first of all, I know you all get this, but just to be crystal clear, the money's not coming unless the Senate also passes it and the president signs it, and that's still going to be a big negotiation ahead. I can't promise what's going to come out at the end of the day. What the numbers that I gave you are what would happen if the House provisions are maintained. The House provisions on state and local relief. And we're going to fight like hell to maintain them. But I can't promise at the end of the day what President Trump will accept or Mitch McConnell will accept. So can they be used for rental assistance? Well, first, we also have rental assistance in the bill, separate from the state and local funding. So if the bill passes, there will also be direct assistance for renters who need help, and we can get you the details on how that would work. If you leave your contact info, I'll have a staff member reach out to you. Could state and local governments use it for rental assistance? I think the answer is probably yes. You know, this will have to be interpreted after it's passed by the rulemaking agencies. But basically what we say in the bill is that it's got to be, if it's an expense, it's got to be related to the coronavirus. And certainly I would argue that if folks in the community are unable to pay their rent because they've lost their jobs due to coronavirus, or they've been furloughed, or their business is shut down and has no customers, then helping them with that would be a coronavirus related expense. And that could be, again, a town that receives this funding. It could be the county receiving the funding and using it for that purpose, or the state of New Jersey receiving its share of the funding and using it for that purpose.
Thank you. And again, I appreciate that you provided us with this opportunity to actually speak with you. So thank you very much.
Of course. Thank you for being on.
Thank you both. Another question that was frequently asked, Tom, was in regards to the Community Development Block Grants Program. Mm-hmm. The question was, when will Warren receive the discretionary funding? They quoted $11 million that was discussed as a result of being left out of that CDBG funding.
Yep. So Community Development Block Grant is a fairly small program that helps with housing assistance. And we plussed it up in the first CARES Act. We added, I think, an extra 10 or 20 million dollars, 10 or 20 billion dollars, sorry, nationally for that program. And under the normal rules of that program, going way back, not anything we did in the CARES Act, the grants only go directly to urban counties and cities with a population over 50,000, which obviously nobody in my congressional district qualified for. No town community qualified for that. So what we did was, myself and other members of the New Jersey congressional delegation, we approached Governor Murphy because the state also got an allocation under the Community Development Block Grant Program, and we urged him to use the state's allocation to help out some of the smaller rural counties that did not qualify and would never have qualified for this funding directly. And we don't yet have a resolution of that from the governor's office. But your question reminds me to remind him, and I will do so.
Thank you, Tom. Our next question comes from Jen Dortsville. Can you hear us, Ginamarie?
Yes, I'm here. Thank you for having
Hi.
me. Good mornings, Mr. Tom. I'm sorry, I'm still kind of sick. Don't worry, I'm home. I'm not getting anyone. Yeah, I've been home since March.
Oh, wow.
A couple things. I work in essential retail, and I'm very concerned with that, with the numbers be so high, because the stores are in like Washington and Hackettstown and Peaburg. Of maybe that's why our numbers are so higher here, because we are not just dense, but we work in the stores still. But I want to ask you, I'm sorry, I want to ask you about the schools, because I hear a lot of talk about the tests, like Mr. Ed covered it. My family lives here, that's why I moved here. And it's the law to send your kids. I have siblings that have the kids. What's going to happen if the kids get sick? And how is the liables? Because in the news a couple weeks ago, I heard one of the other states talking about helping the nursing homes not be liable for the vast loss. So that's another concern I have. And another worries I have, because I is disabled, and there's a lot of us that are elder, we're veterans, we're disabled, we need help that got cut, like the Norris Cap lady talk about some of that help. And you talked about Mr. Ed with the home testing from the Rutgers maybe option. Who's gonna help me with that? Because I be the disabled and I need help with just my regular stuff. So that's just some of my freakouts. I'll shut up now.
That's okay. We're all freaking out. You're not the only one. And those are all issues that everybody's asking questions about. For testing, don't worry. Any testing is going to be free for everybody. That was one of the first laws that we passed. The problem was not the cost of testing, because we said it was going to be free. It's that it wasn't available. We didn't have enough test kits. We didn't have enough masks and gloves and swabs and all of the equipment that our healthcare workers needed to administer the tests. We didn't have enough chemicals in the labs to run the tests. That was the problem. We're working on that. We're trying to get much more testing available for people, including, as I mentioned, for home use. And if you feel that you need a test, either because you feel sick or because you just want to be tested to be safe to go back to work, I think it's very important. If you work in a store, if you work in retail and you're seeing people all the time, we need to open up testing to people like that so that you can feel safe and you can feel that all of your customers will be safe. And that's not allowed yet. We're not at a point where anybody without symptoms, just because they're going to work, can be tested. And so that's what I'm working for. When we get to that point, you asked, how can you get a test? It would be just by talking to your doctor. And your doctor could then tell you, you should go to the Rite Aid, you might be able to get it there, or we can get you a test sent to your home and I can walk you through how to do it on the video. So, that's always the best way to get advice about where to find a test. Right now, I know Lions Hospital has a drive-through testing facility. And that's another resource, but I think you still need to have a doctor's prescription to use that. You have to have some symptoms that say that you might have the coronavirus. And I hear you're coughing. I hope those are not symptoms of anything other than a cold, and I hope you get better soon.
Thank you.
And please know you can always reach out to my office if you have any questions about these things, or if you need any help getting the kind of help that I've been discussing, whether it's on the healthcare or unemployment or disability or any of these other things. Thank you.
Thank you both. Our next question comes from Cynthia. Cynthia, can you hear us?
I'm unmuted now. Can you hear me?
Yep.
Okay.
Yes.
And let me see. I can put my video on. Okay, I'm in Stewartsville. Thank you for taking my call or my actual Zoom question. So the question that I have right now is regarding the current bill that has not yet been passed. Is it a bill still, or what is its status, this HEROES?
So it passed the House of Representatives,
Okay.
and to become law, it has to be passed by the Senate.
Okay, so there's a potential that it may not come to be, and though this is what my question is.
Mm-hmm.
New Jersey pays a great deal of money into the federal government system, and I'm wondering if in some way this legislation gets changed, that we look at potentially considering the contributions that New Jersey has made in taxes, because while this legislation may be something that doesn't get passed, I'm looking ahead at what really is going to be required for us to get fully on board. It's going to require, when a vaccine does become available, large-scale vaccination programs. Many of you here are probably too young to remember when a polio vaccine came and you would actually line up in a public building to get those vaccines. And that's what it took for a long time to get that happening. So there's a lot in a state like New Jersey that would have to really get us back up and running to where we fully were before. And we have been very successfully funding the federal system, if you will, because we've been successful people to make those contributions, fortunately.
Exactly.
We should at least be guaranteed back of what we've put in.
Thank you. Yes, and you actually put that very politely. Sometimes I put it less politely because it makes me very angry. So first of all, I think the bill that we passed in the House, there's almost no chance that it will pass the Senate in exactly the same form, right? It's not going to be 100% of what we did. But I also think it's very likely that something will pass. We're going to negotiate. We're going to compromise. We're going to lose some of the things that I really want. And I may have to accept a couple of things that I don't love. But at the end of the day, we're still, I believe, going to have something that is beneficial to America and to all of us in New Jersey.
Well, I believe that I'm a Jersey girl, and I truly believe that New Jersey's success will be successful for the federal government in terms of the constituents.
Well, yeah. And that gets to your point, which is we are a successful state. Like we've got great education. That's given us a very strong economy. States like ours produce most of the wealth and genius of this country. And as a result, we are one of the very few states that gets less back from the federal government than what we pay in.
Right.
It changes year by year, like between 80 and 90 cents is what we get back for every dollar that we send. I often point out that Senator McConnell's state, Kentucky, gets the most back, $2.41. Can you believe it? For every dollar they sent to Washington. And it makes me so angry when I hear people from those states saying, you know, you guys are mismanaging your state and we're paying for all those welfare recipients in New Jersey and New York. No, on the contrary, right? Medicaid spending and food stamps, everything is much higher per capita in those states. We are producing the wealth and genius and we're helping them.
So
Now,
you
we're all
understand my
Americans.
sentiment.
We're all like, I want to help people. I mean, I want kids in Kentucky and Alabama and New Mexico to get a good education because we're all Americans and it helps us. I just don't want them to hurt us by taking away our SALT deduction, by not investing in infrastructure, transportation. These are the kinds of things that we need in New Jersey. Healthcare, you know, that's what we need in New Jersey, especially at a moment when we are the hardest hit state per capita by the coronavirus. I just ask for fairness. And
Thank you.
that's what we're fighting for. Thank you.
Okay.
Our next question comes from Elizabeth. Elizabeth, can you hear us?
Yes, hi. Am I unmuted? Can you hear me? Can you hear me?
I can.
Yeah.
Okay, hi. Originally, my question was about equine nonprofits, but I want to focus on all small nonprofits. If you're able to get the bill through the Senate, I understand the difficulties with getting all of that. With the equine nonprofits or other small nonprofits that have to be all hands on deck because they've lost their volunteers due to COVID, is there the form to fill out? None of the equine ones, according to an HSUS contact I had in late April, said nobody filled it out because it was just they're too busy trying to run the rescues. And I'm wondering, I mean, this is maybe too naughty a thing, but some way to, if the money does pass, to get it more easily to these nonprofits that are struggling just day to day and they don't have a staff to sit down and fill out a grant application or funding application.
Yeah. Can I ask you to hold on just one second, Cynthia, because this is technically Congress in your kitchen, and I need to turn something down on the stove. Give me 10 seconds. All right, almost burned. So the nonprofits do qualify for Paycheck Protection Program loans, which are forgivable, as well as other assistance that we've created in these bills. So yes, I know it's a pain, but I see one of my staff, John Marshall, is on this call, and he has been helping small businesses and nonprofits in our district work through the system. And you know, it isn't that complicated. And I think if any nonprofit that you work with is interested in seeing what can be done, then we would be happy to walk them through how the process works and to go to bat for them if necessary. We want everybody who qualifies to apply and to benefit, because again, we want that money coming back to New Jersey.
So if a nonprofit, can you hear me?
Yeah.
Can you guys hear me? So let's say there was a smaller one here, or I mean, I know we're focused on this district, but like, let's say there was someone out in Colorado or California, they shouldn't hesitate to try to reach out to their local congressman and just, you know, can we help them? Because I think it just sort of passed them by, you know, and if whatever money's available for smaller ones next time, they'd like to, you know, hopefully be able to. I know you've been trying to address that, and you know, we really appreciate that here.
Yeah.
Okay, so yeah, it's kind of it was kind of self-evident, the answer, so I apologize for wasting your time.
No, it's not. That's why I'm here. And don't hesitate to take up more of our time if there's somebody who needs help in our district.
Okay. Thank you, Congressman. Thank you.
Thank you both. Tom, I'll turn it back over to you for closing remarks.
Great. Thank you, everybody. This has been a great discussion. My only regret is that we still can't do it in person, but the moment that becomes possible, I will be out there again and look forward to seeing you all and hopefully we'll be able to talk about not just how to survive this very difficult crisis, but how we recover, how we grow stronger, how we learn the lessons of this to make sure that we're better prepared the next time. I get a lot out of these conversations. It's vital for me to know what people are experiencing and going through and what's on your minds. So this has been really, really helpful to me, and I hope it's been useful to all of you as well. With that, I'm going to sign off and hope that everybody stays safe and healthy, and that you all stay in touch. Thank you all.